December 31st, 2005. The greatest heart surgeon who ever lived collapses in his home. He's 97 years old, and he's dying of the exact condition he spent his entire career teaching others to fix. The irony? He invented the surgery that could save him. Michael Debakey didn't just practice heart surgery, he invented it. Over 70 years, he performed more than 60,000 operations. He operated on presidents and kings. He pioneered coronary bypass surgery. But his biggest breakthrough was fixing this, an aortic dissection. It's when the main artery from your heart tears apart from the inside. Without surgery, you're dead within days. In the 1950s, Debakey developed a procedure to repair it. He trained hundreds of surgeons, saved tens of thousands of lives. He never thought he'd need it himself. New Year's Eve, 2005. Debakey felt the pain rip through his chest. As a doctor, he diagnosed himself instantly. Massive aortic dissection. The CT scan confirmed it. The tear ran from his heart down to his legs. He needed the surgery he invented immediately, but Mike refused the surgery. His colleague, Dr. George Noon, remembers the tension in that room. The master of the craft was saying no. At 97, Debakey knew the risks better than anyone. The surgery was brutal. Stop the heart, drain the blood. He'd seen patients survive only to never wake up properly. He didn't want to spend his final days hooked to machines. So he lay in the ICU, dying, while the surgeons he'd trained begged him to let them save him. Days turned into weeks. Nearly 2 months later, Debakey finally agreed. Maybe he realized his students needed this. To prove his technique worked, February 9th, 2006, the surgical team assembled, all trained by Debakey himself. The pressure was unimaginable. They were about to perform the Debakey repair on Debakey. For 7 hours, they followed his technique exactly. Every step he'd taught them, every suture he'd shown them. The surgery was successful, but at 97, recovery would be the real battle. There were complications, bleeding, kidney problems. For weeks, it was unclear if he'd make it. After 2 weeks, he opened his eyes, looked at his student and asked, "Did you use the technique correctly?" Against all odds, Michael Debakey recovered. At 98 years old, he returned to work, attending meetings, mentoring students. He lived almost 2 more years, dying peacefully just before his 100th birthday, not from his aorta, from old age. Today, the Debakey repair is performed hundreds of times a day worldwide. The technique he developed saves lives every single hour. He was a teacher until the very end. His final lesson: trust what you know. Trust the people you've trained. Next time on the Patient Zero Paradox, Jonas Salk tests the polio vaccine on his own family.